This is Mary. She's one of our brilliant clinical nutritionists and health coaches. So we're going to talk all about immune health today. And I didn't want to do slides. I wanted to make it more of like a fireside chat, situation, so we can ask each other questions and I can explain certain things and why certain, polyphenolic compounds and other powerful, minerals and nutrients that we put into our body really help boost our immune system more than really any pharmaceutical can in a lot of ways if it's used the right way. So we're going to talk about that. And I think Lindsay here, if you want to introduce yourself.
Absolutely.
Yeah.
Hello, everybody there. Hello, everybody here. I'm Lindsay O'Neill. I'm the CMO at Train Health. And the goal for today is really to give you information and products and solutions that will help equip you for the upcoming flu virus season, right? And not just for you, but also for your family, for your children, so that you can help prevent viruses. And then also if you do happen to get one, because they're everywhere now, what do you do? And how do you get through it as successfully and quickly as possible? And so I'm going to ask all of these beautiful, very talented, very brilliant women on our panel today some questions. And if you guys have any questions for the panel, we will open it up. But just make sure that you, you speak up, because I'm sure whatever question you have, someone else already has been thinking of too.
And I also didn't introduce Lorraine.
Yes, so introduce Lorraine. So Lorraine is joining us from Biotics Research, and we're really blessed and lucky to have you here. If you want to give a little bit of information,
really
background.
Excited. Yeah, so pharmaceutical drugs don't work as well as the natural medicine. Biotics has been around for over 50 years. We do all our in-house testing, quality control. So it's really important what you put in your body is the best out there. And Biotics is one of the best companies out there. They're one of the only companies to have an ISO lab. So everything is tested. Everything is, before it's even processed, all the raw materials tested. It goes through a stringent of quality controls. So we're really excited to be part of this panel, and really excited about Biotics. They're one of the longest nutritional supplement companies in the country right now. So
It's amazing.
And we're worldwide, so really excited.
It's awesome. So to just get started, a couple of housekeeping items. So everyone that's in the room, you have a bunch of papers that you're starting to leaf through. There is an exclusive offer for everyone that's on the Zoom and everyone that's here today for IV therapy. So we have a special offer where you get a free IV therapy session with a package of 4. I believe Ms. Tracy is going to talk a little bit more about IV therapy and what that does for your immune system. And then there's also 20% off on our new online shop. So our website is getting a little bit of an upgrade. If you go to the website, you'll see that there's a link for events. This event is actually on that page. I will be uploading a recording of this Zoom onto that page, so you can send it around to your friends, or if anybody missed it, or if you missed pieces of it, you can go back and watch it at your leisure. And then there's 20% off for the bundles, the immune bundles that we have, as well as the acute viral protocol, as well as the preventative viral protocol. And Miss Mary has been kind enough to provide us with 5 recipes.
Yeah, I think there's about 5 in here.
Yeah.
5 immune boosting recipes that are here, and we're going to put those up on the website as well. So without further ado, I'm going to just ask you ladies some questions, and then anybody in the room or on Zoom, feel free to put your questions into the chat, and we'll shout them out as we go along. So I want to start actually with Dr. Rose. So why is it so important to boost and protect your immune system, especially this winter?
So obviously you know, everyone, the hot topic is still COVID. We've lived through a pandemic. The virus is going nowhere. We're going to have multiple exposures to it. And unfortunately, we have many other viruses in circulation. I know like the media makes it out like there's these triple demics, systemics, but the problem is that we've taken a hit for multiple reasons that it would take me 10 hours to explain to our immune system. And we're going to contract these viruses more easily than we ever have before. Our kids will. Just, you know, I don't know if any of you noticed last year that, I don't know, 50% of even Westport, the adults had RSV. Never in my career as a physician did adults have RSV. So we're going to see things that we've never seen, and a lot of latent viruses or bacterial infections that are now coming about again that we've never seen because of what we've gone through and what we've lived through and what we're still being exposed to. So it's really important to take good care of yourself. It's really important to sleep. Okay, I'm going to just like quickly go through the 4 pillars. So sleep, I'll start with sleep because that's your foundational pillar. Sleep is when your body regenerates, repairs, and detoxifies. If you can't do that, you are going to get sick a lot. Okay. Your body basically in your brain, especially, it has something called the lymphatic system. Just like your body has the lymphatic system that moves all the garbage out. And if these things aren't working properly, okay, and this happens mostly during sleep and you're not sleeping, especially deep sleep, you're not going to be able to fight off infections very well or clear them very well. So that will make you more susceptible. And most of us don't sleep, and we don't realize how important sleep is. So you got to sleep. You got to get to sleep. And there's lots of things and ways that we can talk about that too. And
How much on average for an adult and for a child?
7 to 8. I mean,
Okay.
children should get, I mean, depending, like 12 and under should definitely be getting at least like, 8 to 10,
Mhm.
but adults should be getting at least 7 to 8. And I know it's hard for a lot of us, so that sweet spot should at least be 7 on average, but 8 is completely ideal. And your circadian rhythm in general, like just getting it. So like at night in my house, for example, like evolutionarily, like these lights don't jive with us, like all of these artificial lights, LED lights, where we want to see orange light. That's what we want to see, right? Because when we were hunter-gatherers and we lived in the wild, like it was the fire that, and so when the sun goes down is when our cortisol goes down, and we pass the baton off to melatonin so that we can sleep and our circadian rhythms are in check, right? So you really want to dim your lights at night, make things a little soothing. Like I even go into my daughter's room and she has like I was like, no, I was like, just put your lamp on, honey. Like just put the lamp on. It's going to be okay. Like, and she gives me a hard time about it. But I'm like, these kids are so stimulated. And I'm like, put your blue blockers on. Like if you have to be on the computer and you have, like all of this stuff is stimulating us and like really, messing up our circadian rhythms. And those circadian rhythms are so important to our immune health, right? So I'll start there. I know I don't want to digress. I want to give everyone a chance. And then so that's your foundational pillar. I can do everything I want with you with food, movement, stress management. If you're not sleeping, it's all going to fall apart. Stress. A lot of us, I talked about this at our last webinar conference. We live in fight or flight, most of us, and we have proof in the pudding and a lot of the testing we do and all that stuff. That's really bad. Cortisol is really bad. Like, yeah, again, the primitive brain, evolutionarily, like when we were hunter-gatherers, like we needed that response because when a white saber-toothed tiger jumped out or a bear jumped out, we had to get away. But now in the modern world, we don't know the difference. Like our body still perceives, like when we get upset about something, like when we hear like, when we're exposed to noise pollution, when, we're not sleeping enough, when our kids are stressing out, when we're on, like all of these things are perceived the same way. So we are living more in the sympathetic than the parasympathetic. That then affects your vagus nerve, right? Your vagus nerve is how your gut talks to your brain, and there's a bidirectional pathway of how your gut speaks to your brain and your brain speaks to your gut. Actually, your gut speaks to your brain 4 times more than your brain speaks to your gut. That's how powerful your gut is. And you guys know I'm all about the gut thing. So that's another story for another day. But But that's super, super important in getting that vagus nerve to perform optimally. So it's called vagal tone. So a lot of us walk around with really poor vagal tone. We live in fight or flight. We're in the sympathetic. We're not in the parasympathetic, which is rest and digest. If you guys go back to your, science days and middle school or high school, we don't go there. And so again, shifting and doing things around that, and there's a lot of different things we can talk about around that of improving vagal tone is super important, because when you have poor vagal tone, that then affects your gut microbiome, that affects this stress axis, what I call your hypothalamic pituitary adrenal axis. And again, that's going to really, really help make your immune system crash and burn in a lot of ways. So that's the second thing. And again,
So we have sleep and stress so far.
Food, right? Food is medicine, food is code. Food's code. I mean, we have studies that if you shift somebody from the standard American diet to a whole foods, clean diet, within 3 days, your genomic expression changes. That's how powerful food is. Food is medicine. That is true. So really, putting anti-inflammatory foods in your diet, things that are going to lower the inflammatory burden, things that aren't going to destroy your gut microbiome, things that aren't going to upset this HPA axis, and we'll get into this a little bit with those foods, are so important. And eating right through these, fall and winter days is going to be super important, and just going back to the stress and the poor vagal tone, when it's all like a vicious cycle, because when you don't sleep and you have poor vagal tone, then you want to grab the bad stuff. You want to grab the stuff with the high fructose corn syrup in it, the garbage and this and that. And so getting ourselves into a rhythm, so we're doing all these things in concert. It's like an orchestra, right? Like all these things work together, is going to help our immune system. And then the last thing is movement. God, movement is so important for everything, for inflammation, lowering all these inflammatory biomarkers. You've heard of cytokines, this and the other thing, so important for our gut microbiome health. You got to move. And I'm not saying you should go out and run a marathon or go run even just brisk walking a day, every day, just move yourself, because that in and of itself is going to really help your immune system too, and secrete endorphins and all these other things that have that play off of each other to keep us healthy.
Yeah, it helps with
So-
stress reduction too.
And then we'll get into the supplements and all that stuff,
Yeah.
because here's the thing, obviously it's hard in a way not to practice green pharmacy, you have all these people on a million medications, and then I'm giving you all these supplements, but a lot of supplements, not a lot, maybe a good handful we need, because we're just not going to get it from our food. The soil is nutritionally depleted. We don't get so many minerals that our grandmothers got back in the 19, we just don't get that in the food supply. And while yes, organic is amazing, you want it because of, you don't have the exposure to the pesticides and all that stuff we'll talk about too in a little bit. But, what was that?
Well, I think maybe this is
I
a
was
transition to
yeah.
a question for Mary.
Yeah.
Also, because, we could go down the rabbit hole of organic versus
Yeah.
non-organic, and there's a lot of schools of thought. And then we're in a fairly suburban area up here, and we have access to food. So what would be your top immune boosting foods that you'd have to go to? And can you talk a little bit about the difference between organic versus non?
Yeah, so I'm a big fan of, I'm sure you've all heard eating the rainbow. And there's so much reason behind that. And it's because you get a variety of the minerals and the nutrients. If you eat the same things every day, then we don't have any diversity in our gut. The only way to make a happy gut is with diversity. How do you get diversity? By eating a lot of different foods, whole foods, as well as spices and herbs. They count too, and they really make a difference. So for me, it's the belief of how many colors can you get in a day? When you go to the grocery store, what do you see that's red? Where's purple? That you could fill your basket with some colors, so you know that you are eating a variety during the week. So that's where I start. I start with colors.
And about whole foods. So What do you mean? You mean the store or you mean?
Yeah.
What do you mean?
So if you think about when you go into the grocery store, everybody loves those middle aisles because they're colorful and that's what your kids want and that's the commercials they've seen. But the idea of starting at the very first aisle on the end, and that's got its own different color, that's called God's color, that's natural color. If you start there, then you're eating whole foods. Anything beyond that is packaged. And of course, there's exceptions to the rule. There's dried fruits and there's frozen organic. All that is fine as well. But when they say whole foods, it's something that's not in a package. It's something that doesn't have more than 2 ingredients. It's got salt and then, a bag of almonds, organic almonds, and maybe a little salt. That's it. That's whole foods. Anything that has a list of ingredients, about 4, 5, 6, 8, 10 things you can't pronounce, then you're already not with whole foods. That's not whole foods.
I always say it's like anything that man didn't get in the way of.
Yeah.
Anything
There's
that like
Man or woman.
What?
They
Man
say
or-
that
Man or
food shouldn't have ingredients,
Yeah.
right?
I
If you think
it's
about it, if
whole.
you're eating real food. And,
Yeah.
I call it real food with my children because, yeah, they love to eat stuff out of a box because it's easy and it
Right.
tastes good and there's so much added sugar and
Mhm.
salt
Yeah,
and other things that make it like addictive, right?
Yeah,
For them.
yeah.
So eating the rainbow, eating whole, real foods, starting your shopping on the first aisle that has all the
Yeah.
fresh fruits and vegetables. Now, what about organic? What's important to be organic?
So the thing about organic is, like Dr. Rose said, it's the pesticides, it's the glyphosate, it's the things that they spray on our crops that really do damage. Believe it or not, if you think, oh, is it really that dangerous? It does. It messes with our gut. It really makes a difference. And it also can be a driver of a lot of autoimmune diseases that we're struggling with, or the symptoms of autoimmune disease before the doctor even diagnoses it, right? So it is important to stay away from it. It really is. Now, organic can be expensive. And so there's always the environmental working group, clean 15 and dirty dozen. What does that mean? Well, it tells you the foods that are the most necessary to eat organic and the foods that are okay if they're not sprayed with as much dangerous chemicals that you can eat conventional. So I even like to tell patients to put the environmental working group app on their phone because it's a great way to see changes. It's a great way to look at products we put on our body, which is another topic. But I think that environmental working group is a great go-to for that.
Awesome.
Yeah.
And that's actually another good segue. So thank you guys for just
Yeah.
continuously teeing me up. You're making my job a lot easier. So you kind of touched on it for a hot second there about the things that you put on your skin. So a lot of you in the room and probably on Zoom know that whatever you put on your skin is absorbed into your bloodstream fairly quickly. So, Miss Tracy, when we're talking about our blood and infusing our blood with healthy things that can help us boost our immune system, can you tell us a little bit about IV therapy? Because it's like all the craze right now. Everybody's going to get, infusions done, and they're even coming to your house. So what do you recommend? And tell us a little bit about how it works.
Well, I mean, IV therapy is very important for a whole host of things, right? It can help it can help improve your immune system to fight off infection. It can help heal your gut. It can help with headaches, battle fatigue, autoimmune, issues. There's a lot of benefits to it. And the reason why it's so important is that we lose so many nutrients through our gut, the bioavailability of the nutrients. So even the supplements that we're taking, you're not getting always all of it, especially if you have poor gut health, right? So when you use an IV and you're doing it, you're getting it 100% bioavailability to the cells, to where it needs to go. So, one of the a very good IV cocktail that we use a lot is a Myers cocktail. And that's really kind of a very immune boosting because it's got a lot of minerals like calcium and magnesium in it. There's a whole source of different vitamin B's in it and vitamin C. And those actually help cellular growth and help kind of combat, dehydration. And then you're getting that. A lot of people feel better after the IV because they are so dehydrated, on a cellular level, from inflammation, from whether it's food or from the gut and stuff like that. So people do feel immediately better, and then it actually helps boost it because they're getting that vitamin C. They're not urinating it out. It's not being going through the gut. And they're getting 100% of those nutrients in their blood.
It sounds like we really want to get rid of all of the gunky stuff that's impacting us negatively, so that the good stuff that we're
Yeah.
infusing our body with the food, with the supplements, with
And
the
even with
IV.
the IV stuff too, I mean, we do some gut immune health ones that actually, they're repairing the gut and you're feeding the gut good minerals, and, it's going straight to where the source is and it needs to repair and restore.
Right.
So it's good for the microbiome, it's good for the cells. So patients do feel better with it.
Yeah, I saw it over the summer. My ex-husband got double COVID and the strep at the same time. And he was out for the count until he had IV therapy. And within 3 hours, he was a brand new
I
person.
mean, we've done it here. Like I've come down with something into an IVC, and I'm not kidding you. Like 3 hours
Go
later,
home and you're
I go
fine.
home and I'm like, Robin, I'm fine.
Yeah.
And she's like, see, and so whatever viral thing I was
Mhm.
getting, I've combated it with
Mhm.
high dose vitamin C.
Right.
So it does really help and work.
That's amazing.
Yeah.
So in terms of IV, I've actually never, I haven't done
Really?
it before. I know I
Hold on,
shouldn't admit
please.
that. I know. That's why I wear short sleeves today. I was hoping for a sample, but how often should we do it for preventative immune boosting?
Yeah,
Be my
yeah.
question.
So I mean, every other week to every 2 to 4 weeks, right? So, that you get benefits that last for a long time. So, some people, if they're getting ill or they are combating something, you want to maybe do it a little bit more frequently. Especially when we talk about hydrating, right? And cellular hydration and inflammation. So if someone's chronically ill with Lyme or an autoimmune issue or chronic fatigue, or we do a lot of post-COVID or post-viral infections, you might want to increase that to once a week or once every other week. But to kind of maintain your immune system, I mean, I would say like once a month.
Okay, so once a month unless you're immunocompromised, and
Yeah.
then as often as once a week. And now what about the age limitations? So how old do you have to be in order to do an IV therapy?
I mean, I would say, I mean, any age can really do it, but then you want to be careful, like with pediatric kids and how much you're going to give the fluids, and you don't want to fluid overload anybody. So I think, that would be directed by a pediatrician really for somebody who's probably under 12. So I think 12 and above, because they're pretty much most 12-year-olds are adult size. At least my 12-year-old is. But I would say like, we would want to, they could do the same amount with adults or maybe a little bit less.
Okay, that's good to know, because as I don't know if many of you in the room or on Zoom are parents, but where do we usually get sick from?
School.
Our children
And our
in
children.
school, especially the little ones who always have their hands in their mouth. I mean, like my youngest daughter, I remember she would come home and like touch the bottom of her shoe and then touch her mouth.
Oh, yeah.
Like, oh my God.
So many of us also have college kids, so that's something that I'm
Mm.
thinking about, like when my kids come home for fall break, of maybe having them come in and do an IV to last them through Christmas, because it's all going around all over the place, right? Flu, viral infections, RSV, like Dr. Rose said. So to kind of boost their immune system so that they're in such small quarters, that would be helpful.
Yeah. And they're doing other things
Well,
too. Yeah.
yeah, we won't talk about that.
Well, my daughter at college has a whole kit already.
Yeah.
there that she started. I'm just saying, she got better within a few days and all her friends were still sick 2 weeks later, so.
Yeah.
What?
I mean, honestly,
Yeah.
it's one of those things, like I knock on wood every time I say it, but my kids very rarely ever get sick.
Mhm.
Yeah, I get sick more often
Mhm.
than they do, and probably because I'm stressed,
Yeah.
because I'm not
Totally.
eating right.
Yeah.
And because I'm not
Sleep.
sleeping enough,
Mhm.
and all of the things, I force them to
Mhm.
eat right, and I force them to sleep.
Well, that's why college kids get sick so much too, for all of those reasons
Stress.
that you just said. So arming, our kids when they're away at school, I feel like is so
Mhm.
important, and it was funny because my daughter always gives me a hard time about all my little magical potions that I give and stuff like that. And she was like, oh my God, Mom, your stuff really works. Like she couldn't believe, first of all, she was miserable. She was like, this sucks. She's like, when you're not in your own bed and you don't have your mom or your dad taking care of you, this is awful.
Yeah.
And so now it's just like she takes everything like to the T, like marching orders. Like And she's like, it's awesome. Like everyone else is getting sick. I'm not. And then she literally started feeling like a bunch of her friends again just got there. It's like insane how often they're getting sick. They just got sick again. She's like, oh my God, mom. She's like, my right ear hurts a little bit. It's hurting on the right side of my neck a little bit. I'm on the like the preventative stuff. So I got her started. She woke up the next day fine. She's like, I'm not getting sick. She's like, I will do anything. She's like, because it feels so awful to be away from home and be sick. So it's just funny because she would never listen to me before. And now she's like
Yeah.
all up in me, like trying to make sure that like she gets the stuff that she needs into her. So anyway, it's funny. It's cute.
I always call, I'm 42 and I call my mom every time I get sick. Take care of me.
Yeah. Yeah.
So let's talk a little bit about the immune boosting protocols that we have,
Yeah.
because
I think you should start with Lorraine and
Yeah,
talk about some
with-
of their awesome products that we put into it because they're so
absolutely,
great.
if
They have
you
a lot
don't
of
mind outlining
Right.
the 3 different bundles that are on
Yeah,
the
I don't
shop
have-
page.
Do you
So
have them? No,
there's one
no, they're
for
at the bottom.
under 12.
Right, do you
There's
have the list? I forgot. They're stuck in there. Thanks, Carrie. Thank you. There you go.
I don't know if we
No, does
have,
this have the bundle
no,
on
it
it?
doesn't have
No.
it.
It's kids, teens, adults.
Yeah.
And viral.
Yeah, we have these printed out. I thought we printed them out for everyone, so.
Um,
No, so the under,
Now I.
no, these are not the bundles. So the immune bundles,
Do you want me to grab them?
yeah, can you grab them? I'm sorry. How about we grab them and I'll walk
Yeah.
you through them and
Yeah.
Lorraine can interject. I'm
so
sorry, my memory is not so great.
That's
these
okay.
days.
But talking about kids, like my kids grew up on supplements because I've been doing this for almost 30 years. And, yeah, I'm 80. No, I'm kidding. But my kids are now like, I have grandbabies, but they're all like healthy, like they won't go without their vitamin C or their vitamin D. One of my sons, when he was like
Yes.
16, he had mono. And people would say, oh, he's gonna be out for 3 weeks, he's tired. Within 1 week, I had him better and
So do you
trying
wanna
out
take
for
it out
his
of
ice
the
hockey
thing?
team.
wanna start
And
with the
we ended
kids
up winning the
bundle, or-
championship that year. So they totally believe in what I've been doing for all these years. And now they call me, Ma, I need this, Mom, I need that. So it's great. It really is very preventive. And they've never had ear infections. They've never had any of that. They get through all their colds and flus and viruses with no problem whatsoever. So it really is important to maintain and keep yourself healthy.
So I'm gonna talk about the kids immune bundle first. It's funny, not funny, but I guess I have, also outlined it more for adults, I guess, like if we do get sick. Some of these things in the kids bundle, that's 12 and under. I would say you can increase the dose once they get sick, like most of what they're taking is preventative, right? But like it's hard, right, with kids 12 and under to know what's safe, what's not. And so we pick these things purposely, knowing what they help, what they do from everything from healing the gut microbiome, keeping the gut microbiome like nice and healthy, which we know is so important. And then also like preventing viruses from attaching to this nasopharynx pathway that we know gets, that's the first hit and that's how everything starts. So, and I'll have Lorraine also chime in here as I go through it because we picked this product.
This
Which
is
is
one
an-
of my favorite.
This is an
products.
awesome product. This is children's ENT. What do most of your young kids come home with?
Ear, nose, throat
Here.
issues.
Right?
Yeah.
Okay, Lorraine, go ahead, explain.
It's
the
actually a
it's a proprietary formula
Yeah.
that they came up with. It's
Yeah, and it's
fascinating.
a probiotic, but it actually works upper respiratory. It's a chewable and it also has xylitol in it, which is great for their mouth. So how we recommend it, and I had several doctors even say it. I have the kids brush their teeth,
Mhm.
then I have them chew one for preventiveness.
Mhm.
That xylitol gets into their mouth and kills the bacteria. Also will kill all the bacteria in their upper respiratory while they're sleeping. It even breaks down the biofilms, which is really cool. And it tastes great. So this is a children's ENT. It also comes in an adult ENT. Same.
Bless you.
Bless you. Same product, but 3 times stronger. So one for maintenance, and as Dr. Rose said, as they get sick, you can titrate it up to almost 6 or 8 a day. So it's really good during the day, but I always recommend 1 or 2 before bed and have them chew on it and have it stay in their mouth. It's one of the best things for bacteria, tooth decay, My granddaughter breathes out of her mouth and my daughter-in-law, I forgot to tell her to take it at night. She was taking it giving it to them in the morning. So she just started giving it to her at night because she has breathing problems. So all that bacteria stays in her mouth. And with this, it'll break it all down and prevent the problems that she's having with her teeth. So one of my favorite products, we recommend after opening to refrigerate it.
What's the name of it?
It's children's ENT, and then the adult one is called adult ENT. I take 2 before bed every night. It just helps after COVID, after I had COVID, I had that drip.
Yeah.
And if I take 2 at night, I sleep better, I breathe better. It's one of my, and they taste great. And I have really soft teeth and bad
Yeah.
gums, so I like to have it stay right in my mouth and chew it.
Yeah.
14-year-old take the children's one, or what would you?
I would probably, depending on their weight, so
Yeah.
most products are based off of, like, if you see a bottle of supplements, it says 90 capsules. So that's usually 3 a day. It's usually a 30-month supply, and most of them are based off a 150-pound adult. So, if you have a 14-year-old, 120 pounds, I would probably give them 1 adult because it's natural. I would still give them 1
Yeah.
adult. I would do 1
Yeah.
adult.
Is adult still chewable or no?
Oh, yeah. They're the same product, just 3 times stronger.
And this is a part of one of the bundles that you guys will get 20% off on that are on the website, or we also have them available today, right?
They're all here, yeah.
Mhm.
Then the next product that I chose, which I love, is this Immunoberry by Designs for Health. I love this product because it has so many things in one. Like, I love the children's ENT, which is the backbone to the protocol. And I love, obviously, I'm a big probiotic fan, and these bacteria that Lorraine was talking about are gonna, you don't just have a gut microbiome, right? You have an oral biome, you have a nasopharyngeal biome, you have a lung biome, all these things. So super, super important. But this has, and I know you guys have all heard of elderberry, astragalus, shiitake, and maitake mushroom, which we know are so immune boosting and amazing. And our kids are not going to eat mushrooms. So what an awesome way to get it into them. And has some wild cherry and beta glucan. I love beta glucan. Beta glucan is so fantastic for our immune system. It's amazing for gut health, healing up tight junctions, like all these things. So this is so easy. It tastes good too. And it's just like another good addition to sort of like layer on some things and get some things into kids. So you can, I will make sure that we send out to the group the dosing, because like, it does say 1 ml, but for the younger kids, we might want to give like half. So I'll make sure that we have all that available to you. So don't worry. The next thing is vitamin C. So I love vitamin C. The problem with vitamin C is if you take too much, you're not going to absorb it all you won't absorb it all, like you're just going to pee it out. So you want to just make sure you're taking the right amount. Although when you do get sick, your body uses up an incredible amount of vitamin C. So that's why you hear when people go on like 5 grams, 10,000, 10 grams, so on and so forth. It's because it's so immune boosting and what it does for a lot of your immune cells in general. Again, diet wise, you think you're getting, most kids aren't getting probably enough vitamin C either. These are delicious, they're chewable, and you just give them like sort of like a prevention dose. You give them like the 1 chewable tablet or 2 a day, and then if they get sick, you can increase it and divide it like twice a day. But this is a great product. C should definitely be part of that armamentarium of treatment for especially the fall, winter season, and just in general, even just throwing a vitamin C on board every day. It's not going to hurt you. You just pee it out. And if you take too much of it, yeah, you're going to get diarrhea probably. So, you want to just be careful with how much you use. And also too much vitamin C in people that are prone to gout, or kidney stones, rather, making kidney stones. You have to be careful there too. But when you're sick, like I said, your body's going to use so much up that if you are prone to kidney stones, it's okay for that limited amount of time to take the higher dose of vitamin C.
How many milligrams should kids take versus adults?
So
on a daily basis?
the kids I have 500 usually taking that, like and adults, I think we should be taking like around 1,000 a day. The other thing is adults is is, and that's in the, when we get to the teen bundle and the adult bundle, the immune packs. Taking, citrus bioflavonoids with vitamin C is super helpful because it helps get that vitamin C absorbed and it works more optimally.
Yeah.
So anyway, but not to make a side note. Okay, let's go
Well,
to,
I wanted to pause real
Yeah.
quick and just ask
Yeah.
Mary, which is why I moved the
Yeah.
camera. So talk about foods real quick, if you don't mind, that are high in vitamin C and like bioavailable vitamin C.
Definitely green leafies. I think
Mhm.
that is a mess
kids
with so
gonna
many.
be, how you
people.
get that into kids, right?
And it's gonna be hard for kids, right?
Yeah.
Um,
That's the supplement.
that's
Sorry.
a supplement, and also I think a lot of people don't realize that, because I know teens make smoothies. A lot of
Yeah.
people think of your
Kids can make
berries.
smoothies.
Right, I think
My kid,
teens
my
do.
my
They
little
like-
kids love them. Like when my kids were
Right.
younger, they love smoothies.
Great place to sneak in the greens.
Yeah.
And when I say greens, it's not the same thing every day. Change it up. Again, that diversity. You want kale, you want collard, you want a whole mix,
Spinach.
change it up. Spinach is good. Never the same every single day, week after week, but I really love. And what happens is when you put in your berries and maybe your peanut butter or your almond butter, you, other than the color, you wouldn't know that there's greens in there.
Right.
So,
Yeah.
so I really, okay, great.
Okay, so
Thank
then the next one for the kids was this Immuni Z, which is zinc, which is always good to have a little bit. Too much zinc isn't good to watch. This is a good dose. Adults, you really don't want to take more than 25 to 30 a day if you are taking it daily, because then you could deplete your copper stores and that can, give you problems. So sometimes too, when adults need a higher requirement of zinc, we'll throw a little copper in there too. And some of like the immune pack has the copper in it already. Like Biotics is so brilliant the way they formulate a lot of their supplements, because they're always thinking about what you could be doing on the other side. Yeah, it's great to take all these things, but there are downsides and you have to understand and have the knowledge to to know these things. That's why having people like us in your lives is good, because we can help you navigate, and there's a lot of noise out there too. So anyway, zinc is fantastic. Zinc is so great. Obviously, once you get it into the cells, it's so great for helping fight intracellular infections, and it's amazing also for helping repair the gut barrier, that intestinal mucosal barrier. So very, very important. Vitamin D. Everyone should just take D. I don't care. I don't care if you're like, I'm outside and I live in Florida, and like, I don't really care. Because guess what? All my patients from Florida and from all the sunny states are significantly vitamin D deficient. And I'll say this again, I'm like a broken record. This drains your vitamin D, this drains your vitamin D, this drains your vitamin D, everything drains your vitamin D, okay? Unless you are in the sun with half of your body, over 50% of your body exposed in the midday sun for 15 to 20 minutes, you will not produce the amount of vitamin D you need. Every single cell in your body has a vitamin D receptor. It is not just a vitamin, it's like a pro-hormone, okay? There are numerous studies, I won't even get into the immune part, numerous studies just prognostically on people that have low vitamin D levels, that they do poorly when they get sick, when they, COVID, that's a great example. They saw that people with low vitamin D levels had much higher morbidity, much higher mortality. You want to have high vitamin D. You want your kids to have high vitamin D. Super important. And it's very hard to get toxic on vitamin D. So
If
yeah.
you're not low in it, should you take it?
you are low.
Well, explain.
You are low. Your conventional like laboratory that's saying you're at 30, you're so low. Like you should be between 60 and 80.
That's the functional medicine, yeah.
You should be
Yeah.
between 60 and 80, and even our very chronically ill patients with cancer and should be above that.
Yeah.
It's very hard to get toxic on vitamin D, very hard. And so, yeah, do I watch it? Like when I have my patient and they're at 90, sure. I'm like, you're going to take a break for a little bit, but most people struggle to just keep it in that range because of this dynamic relationship that I'm talking about. Like it's really hard, and like I said, most of us are indoors most of the time, even my patients in Florida, right? Or, for example, or Arizona or whatever, because they're working all day and this is draining them. So you're going to be low in D, and it's so important. So important.
It's also with the blood tests,
No,
they're testing you at a specific point in time. And so even with your hormones or other levels, the range for you might be different for the range for you and might be different from the range that you need to be in at different points throughout the year. You know, every body is different, and your body today is different from your body 6 months ago and different from how your body is going to function 6 months from now. So all of these supplements, you know, Robin said many times over, D is the most important. Like
Yeah, like
everybody should be
like,
taking D.
listen, do some of my patients take a break? Like, they're like, well, and I'm like really jealous of them, but they're like, I'm gonna be at the beach all summer and I'm gonna be outside. I'm like, that's awesome. And like, if their D is really high, then maybe they can take a little break. That's okay. I'm fine with that, you know, because I know they are gonna generate like, like if you're sick and you're lucky enough to like live somewhere warm, you should get out in that sun, like during the day when you're sick, because you will produce 10,000 IU of vitamin D from being out in that sun for 20 minutes with half of your, you know, like I said, more than 50% of your body exposed. So that's like the best. And I will say, when you get sick, I have my patients start taking 10,000 a day. I have them get up to very high doses every day while they're sick. And then once they start to feel better, they can go back down. On average, I keep people at 5,000 a day. That's the sweet spot for
So
us.
What do you recommend for children?
I have the kids do 1,000, maybe really little 500, but like I keep them and maintain them at least on 1,000.
And so
My kids, I'm aggressive. They do a little bit more, but yeah.
a couple of people have asked about sunscreen. So you're talking about exposure
Yeah,
to
no,
the sun.
the sunscreen, you got it, no sunscreen. The sunscreen blocks it.
Mhm.
Yep.
Yeah.
That's why. one of
That's the
your-
good and bad of
Yeah.
sunscreen, you know? But yeah, so
Just
I
wear a
don't
big
even,
hat.
I don't even wear a lot of sunscreen when I go, which is so bad, right? So, but I sit in the sun, I mean, sit in the shade a lot, but like when I go away, I don't have my sunscreen on, and then I'll like be out there and then I'll apply it like
Mhm.
after the fact.
Mhm.
It needs to be
Yeah.
on your whole body, it can't just be top of your head.
It needs to be at least 50% of your body needs to be exposed in order to get what it needs to convert, to do that chemical reaction in your body to convert it to the active form of vitamin D.
It's really hard to keep your levels up.
It's so
Mhm.
hard. It's a constant struggle. And it is such a powerful antiviral, antimicrobial. I mean, there's studies done showing like,
Anti-cancers.
oh yeah, cancer is huge. Like actually studies are done with cancer patients, like prognostically, the patients that have higher D levels, they do better on chemo. They have better survival rates. But even with kids getting sick or adults, there's tons of studies that show like patients with higher vitamin D, they have less days of work missed, they rebound faster, they have less days of fever, less days of runny nose. So it's like very important to like, and then it's okay to pounce on that D, just like the C, when you're sick. Your body needs that. It's gonna eat right through it.
Now, one point of clarification around D.
Yeah.
So there's a lot of D that you can go to the store
yeah.
and buy. Not all D is created equal. So tell us what specific
You
D
want
we need to look for
D3.
with.
You want it with K1, K2. Some of ours don't have the K1, K2, but that's a whole other story for another day for some chronically ill patients because of issues with microclotting and things like that. But in general, the D should have some K1 and K2 because what happens is the K1 and K2 is like sort of like the director of the cruise ship in a way. It's like telling everyone where to go. So like when you convert the calcium, you know, from having the D, it's directing the calcium to get into your bones and into your teeth and not deposit in your soft tissues and in your blood vessels. So I always cringe when I see a patient come from their primary doctor that's giving them 50,000 of D2 a week. And this is like, it's like, you don't know what you don't know. And so I was one of those conventional doctors until I understood all this and, you know, understood the research and literature behind it. That's bad because that type of D is going to find its way into your soft tissues and your blood vessels. So just be careful, be an advocate and make sure, you know, you're getting the right stuff because a lot of doctors are reflexively prescribing that 50,000 D2 when people are super low, and it's not the right D to take, unfortunately.
So 2 more questions.
Yeah.
So one for Mary, tell us about some D foods.
Well, I think that you want to get a variety of foods with D in it. So I would say there's a lot of things you can do in combination. You want your fatty fish, which also has the omega-3s. You want wilds and you want you want wild fish always, but your small fish like your anchovies and your mackerel and your sardines, right? And when you have it with skin and bones, then you're getting an extra boost because then you're getting your dietary calcium, which is also helping with the D. So I'm always a big fan of dietary nutrients also. So yeah, so the small fish variety in even just your, you know, your greens, your cruciferous, you know, it's really important to have all that sulforamine and
Sulforaphane.
sulforaphane in your cruciferous vegetables. And it's really important also for ridding your body of toxic elements. And so you know, a lot of people don't realize that even garlic and asparagus, these are all sulfur vegetables. Along with garlic, I also really like ginger a lot too. Garlic, ginger, these are great things for boosting your immune system. With garlic, there's something called allicin in it. So you want to chop it up and get all the components, and then you can eat it either raw in a salad or partially cooked. I like roasting it with some rosemary and olive oil. That's delicious. I always do that. That's my go-to when I'm getting a cold or getting run down, as well as ginger tea is wonderful. But it's at the first sign of a cold, I really do think the benefits in ginger and garlic are like bar none, the best things. Ginger tea, you just chop it up fine and you simmer it in some water about 10-15 minutes. You really want to get it nice and simmered. Drink it spicy. You'd be surprised what it does for a sore throat. You can add some honey if you want. It's amazing. It's really great.
And garlic, just a little side note, I learned this summer. If you take garlic every day, the mosquitoes stay away from you.
Yeah, because you stink.
I know.
Because you stink.
Yeah.
What do you think?
But
Seeps
you
through your
can,
pores, they
yeah,
smell it.
but I mean, I'm Italian, so I use a lot of
Yeah.
garlic in my
Mhm.
cooking. And I used to be a mosquito magnet. And this summer I started taking garlic pills that didn't make me smell. I don't think. I mean, I still, you know. Yeah.
Wow.
Yeah.
Yeah.
Time of day and like for vitamin D, zinc, like when's the best? time
Yeah,
of
so
day?
that's such a great question. So zinc hurts a lot of people's tummies. I think a lot of that also is because the product's not great, to be honest with you, and it's not made the right way and it's not the right bioavailability and so on and so forth. But I always tell my patients just take it with like after they eat. Nobody ever gets sick or feels nauseous. So like zinc, D, it's fine. You could do C the same way. So I usually say like sort of after breakfast and then after dinner sort of thing. Obviously there's certain things you take at that time, like the children's ENT. Probiotics are great too to take at that time. That's when your body, you know, again, is that in that repair regenerative cycle, and the probiotics really do a great job. You know, they're a major player there. So that's why it's good to take that. But if you take it in the morning, it's fine. It's not gonna, I don't want you to be like stressed about it where you have like, again, our lives are stressful enough, but like timing it like that is probably the best thing to do. We probably should go on to the next pack because we're not gonna get through it.
Yeah, and
Yeah.
I was actually gonna ask,
Yeah.
if you could go through rhizo and medicinals as that are part of the,
Yeah, do you want me to go through the teen bundle fat, like just run through it?
yeah,
Because
we
there's
can run through that. Does
Okay.
everybody want to hear about the other bundles?
Yeah,
Okay,
so
let's go through the
the,
teen.
I did 12 and up.
It's really
Um,
12 to 25,
Sort of,
right?
yeah. I mean,
Can I just ask,
Yeah.
there was a Zoom question about this
Yeah.
specifically,
Yeah.
so would the teen one be good for college age students?
Yeah, that's why I
Okay.
wrote teen and up.
Got it.
That's why I wrote, that's why I did it that way, because I knew people were gonna be like, what can my college students say?
It's really
So-
12 to 25, and then there's an adult for 25 and older.
Rhizo.
Yeah. Okay, I'll start with the immune support pack. So this we did, because this is gonna be so easy
For the teens.
for
especially.
teens especially, or for you to take. And I know a lot of people like my teen doesn't take anything. They only take liquid, which
Mary.
is not good. Indigo, you gotta get your
That's all.
kids to swallow pills. I got my daughter, I'll give you all a little tidbit of information. I got my daughter to swallow pills. My oldest, my two younger ones were swallowing pills at 5 and 6 years old.
Oh my.
It took her till 12, 13 to finally swallow. You know how we did it? We bought and this is terrible because I honestly, I would never tell anyone to put this in their body, but I was desperate times call for desperate measures. And I got like those disgusting, the Tic Tacs, the colorful ones that have a million chemicals in them, but because they taste good. So she started putting them to the back of her throat and swallowing them, and that was it. And I've given that little tidbit information to dozens of people, and they said it works. So try that. It's fine. Your kids will detox from it. It's only a few, so it's okay. All right. So this immune pack is awesome. We're gonna have Lorraine talk about it, but why we love this is because everything's in, do you have the samples
Yeah,
or no?
Yeah, right down here.
Oh, let me see. Amazing. Amazing. It's all right there for you, like ready to go. You take it. It's 1 pack a day.
Yep, 1 pack a
So
day.
I say 1 pack a day cause I'm looking at the dosages on here. I say 1 pack a day for maintenance. Go to 1 pack twice a day when you're sick. Do you agree?
Absolutely.
Yeah, because all of the things in here, A, C, D, zinc, selenium, copper, N-acetylcysteine, elderberry, EGCG, which is green tea extract, amazing. Like one of the most amazing things that we don't take advantage of enough. What an amazing compound. Astragalus, coenzyme Q10, quercetin, and citrus bioflavonoids. And I will tell you that quercetin, and I'm sure you guys have heard a lot about quercetin through the pandemic and so on and so forth. You need it you need what's called a zinc ionophore to push it into the cell. So a lot of people don't understand this, but quercetin won't really get where it needs to go unless you are pairing it with the zinc. So again, this product is very smartly thought out. I love it. And it's so easy. And like, how easy is this for your kids, your teenagers to take, or if they're at school?
So it's five pills.
Yeah, it's only 5. You just, all of this is in these, no, you take it all in the morning.
Or you can separate them. I've had people say they'll take
Just
2.
take it. I mean, that's fine, but like,
You could separate if you wanted to,
Yeah.
like do 2 in the morning, 3 at
but then
night,
you're gonna
2.
forget,
Yeah.
like, just get it in, like, take
After
the 5,
breakfast.
be done.
D in that.
Oh,
Yes,
Oh.
yes, high
Everything's in
doses
there.
of it. You
Everything's
have
in
4,000 of D. You have 1,000 of, all the
Mhm.
things I was saying you should do.
Yeah.
1,000, I swear I didn't cheat, I didn't look at it. 1,000 of C, you have 25 of zinc, perfect dosing. It's great. You have your selenium, your copper, and acetylcysteine, amazing. NAC is a precursor to glutathione, which is your master antioxidant in the body. Every cell needs glutathione. We need glutathione. Glutathione is eaten up so quickly when you get sick. Even the CDC put out a paper about 2 years ago showing how of all the viruses, COVID exponentially decreases your glutathione stores. So, most of us are already down in glutathione. So having that NAC on board, and NAC is also a very strong mucolytic. So like when people are like, oh, I'm going to go get Mucinex, I'm like, no, I'm like, you're going to take NAC. I'm like, cause Mucinex is garbage. It's like, like obviously, again, like not natural. I'm like, and this is gonna do just as good of a job for you to like break all that up, So and the elderberry for so many different reasons, what that does for all these different pathways in the immune system. So it's just a great product.
It's really
Awesome
patient
product.
compliant, so it's really, it's easy. I remember when we had COVID, before we came out with the packs, I had the NAC, the vitamin C, the vitamin D. So by the time you bought all that, you were spending like $300-400. And then the company came out with these packs, and it's like, my husband's been like, how much do I take of this? How much do I take of that? I'm like, here, honey, pack. It's like, this is the best thing ever. So it's really simple, easy, and they're not separated. So it's all mixed together. So you're not picking out a vitamin C or a vitamin D. It's all mixed together. Where a lot of packs, they'll have a vitamin C, a vitamin D, and mix a bunch of them. These are all combined together. So it's all.
That's why I say just take it all together in one
Could
shot.
you put those in a smoothie?
Oh, yeah. You can open them up. They're capsules.
You can, but it won't be as good. But
Yeah.
Really? Because.
no, because you're gonna
The time.
lose a lot of it and like the acid in
the
your
sides.
stomach and.
When you're
But
poured
also
out,
like
some of it's
how,
stuck around the
but
side.
also the capsules are meant to get
Time
past the
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 gut.
stomach and get
Yeah,
into your gut, a lot of this, so it's fine, it's just not as good, it's just, I want to be honest and transparent, it just won't be as good.
In regards to timing, is it okay to take all that at night? My daughter doesn't eat breakfast.
Yeah, so
I know.
my kids
Yeah.
take their vitamins at night,
Okay.
Yeah.
because I can't catch them. So they just, they do this and this, I'm gonna talk about, they do it at night.
I
Yeah,
do all mine at night
But
too.
there's nothing in there that
Right,
would keep
during
you up,
dinner.
because my
No.
daughter has issues with sleeping,
Yeah, that's
and I'm
right.
worried about some of these supplements.
There's no
with
fee.
No.
No,
no, there's
No,
no, there's
there's no
nothing
fee.
in there that should,
Okay.
there shouldn't be anything that would disrupt her sleep.
No.
no, not at
Right.
all.
Yeah, that's a major problem for her, so
Mm.
I won't bother.
You should give her some magnesium, that's all.
She
it
takes
is.
that.
Okay, good.
Magnesium bisonate, but still not enough.
Yeah,
We have sleep stuff.
all right, so black seed oil. This is like black cumin, what is it, Nigella sativa. These are, these are the capsules, yay.
They're calling it the miracle herb.
So there was a major study actually during COVID. This is when I found it. It was at 4 major centers, Chile, Pakistan, America, Canada, and the US. And they actually showed patients that took this at the right dose when they're sick, actually had statistically significant. They avoided the hospital. If they were in the hospital, they got out of the ICU way faster, like all these different things. So, so this is great preventatively, what it does, again, on all these different pathways in our body for helping the immune system, and also when you're sick. So you would increase the dose when you're sick. You would do like 1 twice a day or 2 a day, and then you'd go up to 2 twice a day when you're sick. In this form. If it's in a different form, I would just say stick with this because it's too complicated for me to get into the dosing and per kilogram. But this is a great product. Rise Out. This is one of my favorite products on the planet. This is a pre, pro, and postbiotic from, are you going? Okay. This is a pre, pro, and postbiotic. It's from unmined soil in South Africa. So I'm going to explain to you why this is so important. So basically through urbanization, deforestation, industrialization, we've lost like 80% of our microbes. This is one of the reasons why there's an epidemic or even pandemic of chronic disease. So you don't have the microbiome that we used to have, okay? And the soil-based organisms, like when I say humus, that's life, that's the earth, right? And so this is from unmined, meaning untouched humus. So all of the organisms that were from before, like probably over 100 years ago, because we were always in touch with nature, right? We would forest bathe, we'd be walking, we'd have direct contact to the forest. Our feet would be walking in the dirt and the sand. We'd be breathing in and inhaling and swallowing all of these organisms. We don't anymore. And so these soil-based organisms are so important in helping our immune system and helping the good bacteria in our gut multiply and thrive and survive. And the things in this, it's all this isn't touched like when things go through like a lab, and there's nothing synthesized in this. This is blackstrap molasses and the humus. And in the humus are 42 groupings of soil-based organisms. And then when it comes together in the right way, a 43rd group forms that does this powerful thing or powerful things in your body. And so this is fantastic for healing your gut, for healing the other biomes in your body, because the bacteria has specific properties that through this thing called quorum sensing, where they know where to go, they just naturally know where to find the inflammation or the infection in your body and help you heal. Okay. So it tastes like dirt. I'm not gonna
It's like molasses.
lie.
dirt.
Yeah, it's like molasses
dirt.
dirt.
Yeah.
Some people like it. It's
I
hard
like
to
it.
find
I
it.
think it's teriyaki sauce.
Oh yeah, it does. That's
like a
what
little
it
like
tastes
a-
That's so funny.
Which is not terrible.
So you can give this to babies. In South Africa, they give this if they're a week old. I'm not suggesting that. We say 2 and up, okay? We say 2 and up here, but and we can give you the dosing for the little kids, but once even like a 5-6-year-old could take like a quarter to half a teaspoon, they'll be fine. But
And you put it in water.
Yeah.
oh yeah, and you need to activate it with a little water. That's once that bacteria get activated by the water, because they're lying dormant in the blackstrap molasses. So and then you mix it up, and then once it hits your gut, they know what to do. And so it's fantastic. So even I'll just anecdotally, we're gonna have some clinicals and trials out in a handful of months, but not yet. But anecdotally, I will tell you what it does in my life. So my son, he hates taking any vitamins. And I have to put this in a little bit of orange juice for him, but I swear he tells me that this is changed. He's like, I hardly ever get sick, Mom, now that you put that. And then if he starts to get sick, he gets this into him and it's done. It's done in a day or two. And you guys know that like your kids, when they get sick, it lingers for weeks. Like that's not happening in my situation. It doesn't happen. Like they're over it quickly because they're armed with the right things and they're taking the right things to really help their immune system. So it's so funny, like he actually seeks me out, even though he hates the way it tastes. And he's like, you have to give me the Rhizo like right away. So I maintain my kids like on bi-weekly, like on twice a week dosing. Like I give it to them like Mondays and Thursdays. But then when they start coming down with something, or if they're exposed to somebody that has the, like, I'll start getting it into them every day to like sort of. No. So it is when I'm doing like gut microbiome work or people that have chronic issues or problems, like, and I tell everyone like for the first 30 days, you can titrate it up and get it into you because we all have dysbiosis, we all have leaky gut. So I'm like, just get it into you and then go to like a maintenance dose,
Okay.
So
So for the kids.
So for the kids, I would, if you're gonna give it to them and they really don't have any issues,
Right.
depending on like my kids are 12 and up, so I give them a teaspoon twice a week.
Okay.
I maintain myself on a teaspoon 3 times a week, like I do Monday, Wednesday, Friday. When I start to feel sick, I do it every day.
And I will tell you, so I've been doing a gut microbiome
Here's another
test
anecdotal story.
on myself since I was diagnosed with lupus 6 years ago.
They don't know what lupus is. You have to tell
Oh,
them.
rheumatoid arthritis and lupus. It was like the perfect combination of 2 autoimmune diseases. And it just, everything wrecked my gut from the steroids that they put me on and all the other things that I was taking. But my gut was a mess to begin with. And, so I have done this test, which has 4 different indicators of leaky gut: Candida, zonulin, Oclidin, and LPS. And I struggled to find a solution for all 4 of them, not just for myself, but for all of the other people that I was working with. And this is the one thing that actually addresses all of the indicators of leaky gut, which is like a breakdown of your gut microbiome. Your gut is only the thickness, the lining of your gut is only the thickness of a single piece of hair. So it's very susceptible to damage, to leaks, to breaking down of the conjunctive joints. And so the Rhizo, I've actually been taking for the last 2.5 weeks every
No,
day.
not even.
Not even 2
10
weeks.
days, 10 days. I feel like
10 days. Yeah.
10
And I
days.
did a gut microbiome test like 4 days in, maybe not even, maybe like 2 or 3 days in. And the Candida that I had 6 months prior was already.
But
like,
tell them
gone.
about your symptoms with the medicinals and the, remember you had a horrible flare?
So I had
Tell
a
them-
horrible
I
flare.
put
So-
her on, okay.
Yeah,
tell
so
them.
I had a re-flare about a month ago
Oh, yeah.
because of
No, she's
Oh.
readjusting.
Oh,
so
it's
that
okay.
they see you.
Hi,
People
everybody.
are just looking
I
at her.
forgot about that. I got sick over the summer and the doctors were like, you have to go on antibiotics. And I really didn't want to go on antibiotics. And so I went on antibiotics, and my 3rd pill of penicillin, I went into anaphylactic reaction and I had to be rushed to the hospital. They jammed an EpiPen in my leg. They had a crash. I've never gone to the emergency room where they don't even ask you your name. They just bring you in. My whole face had swelled up. My tongue had swelled up. I couldn't breathe. And I had chewed 2 Benadryls, which is nasty. But they put me on tons of epinephrine and steroids. And because of that reaction, my body went back into autoimmune. So my hair started falling out. I would wake
Joint
up in
pain.
chronic pain, like almost every day. I can't see, I can't breathe. I'm like chronically fatigued, and this has been going on. So, when I joined working with these lovely folks, Robin's like, well, you have to feel good because, or else, you can't, you have to basically take these things. So I started taking these things about 2 weeks ago, and I would say I feel about 90% better. in
Yeah,
just
but
2
what did you
weeks.
start? Tell them what you
So
started.
I take medicinals
Which
and
I'll explain that
Rhizo
to you.
twice a day,
Mixed with water.
mixed with water. And then I boosted my D, and then I'm taking a methylcobalamin And what else am I taking?
I don't,
That's
yeah,
it.
I just started this stuff for the autoimmune. for the
Yes.
autoimmune.
And I mean, it's so much better than taking the things that I took 6 years ago when I first was diagnosed with lupus. Because all of those things that I was taking had side effects. And so it just made me feel worse and crazy. And I had like a full emotional breakdown 6 years ago. Whereas now I feel like, well, I have a good foundation, I have a good knowledge base, but also now I have new tools in my tool belt to help me with this. So anyone who is chronically ill and immune compromised like I am, this should be a staple in your everyday life. For my children who are 13, 11, and 9, they've started the Rhizo as well. And I'm hoping this winter we're gonna get through it without any major illness.
Okay, so let's just run through this because I feel like people are losing their steam. So the adult immune bundle has very similar thing, like that's for we made it easy for the teens because they're just like,
You're not gonna take.
they don't want to take a lot and they get annoyed easily and they're busy and so I made it easy. That's it. And if they get sick or they have something, I have an acute viral protocol that they can take, or you should have in your house ready to go. And that's all listed and we can talk about that. But for the adults, it's pretty much very similar. It's this, because again, why not make it easy for the adults too? It's the Rhizo. Where's the
On
Rhizo?
the floor.
Okay, Rhizo. I did the Black Human. I did this too because it's a great product. It's wonderful. It's well tolerated. And then I also did, I think everyone needs magnesium. I just do. Magnesium is so important, like a little maglycinate, magtorate. All magnesiums do different things. I didn't do any magnesium that's going to make you poop more than you should because I don't know who I'm giving this to necessarily. So this is great. Like taurine does a lot of stuff like in a lot of our neuro pathways, neuroinflammatory pathways. So I just really like it. It's also great for cardiovascular health and things like that. So
You take this one at night?
you take it, magnesium is very relaxing. So you take it at night.
And that's glycinate.
This one's taurate. I did, yeah, but you could do one taurate, one glycinate. I'm fine. I like any of those is fine. When I'm working on people getting their bowels going and getting them to poop better, because that's another story for another day, but we need to poop. We all need to poop really well so that we're
Citrate.
healthy. I do like oxide, citrate, like some other ones that are very helpful in getting things, going down there. But we have over 300 different biochemical pathways that require magnesium, and the vast majority of us are mag deficient. We are magnesium deficient. We do not get magnesium really from the dirt, from the dust bowl of our soil anymore. It's really not there. And so even though we're eating healthy, we're just not getting enough of it. So this is another one of those, magnesium is another go-to supplement that I have a lot of people just take regularly, and because it's just so good for you.
How much do we take?
I say like 1 to 2 at night, depending on what your needs are. Like, and most people like figure it out. They're like, oh, I notice I feel better with 2. I'm fine with 1. You could, like 1 to 2. Like this has 1 capsule. I usually will put a lot of my patients on 2, depending on like what their,
Right.
what their symptoms are and things like that. But it's not even that dose. It's not going to overdo. I have patients that are on the other forms of magnesium, like high doses. So it should be fairly fine and fairly safe. And then
The blue.
I have melatonin. I don't know where the melatonin is, but do we have the melatonin?
Yes, that's-
So melatonin, I give everyone, so melatonin, most of women too, like middle-aged women, then, your pineal gland is what in the middle of it's the speck in the middle, like when you see an MRI, it's like, what was that called? The evil eye? I don't know, not the, but
The third eye.
the third eye. There you go, the third eye. And it starts to calcify as we get older. And so you make most of your melatonin, between like, as you get older, your melatonin stores. And that's another reason in COVID, why we believe that melatonin has played a huge role. That's why kids, infants, adolescents, young 20, they're fine. They're completely fine and not even symptomatic mostly, because that melatonin is such a potent immunomodulator, antimicrobial, antiviral. It's
And
like
levels haven't
amazing.
dropped yet.
It's amazing for everybody. So anyway, So melatonin is so important for gut health, for brain health. It's fantastic. So you don't have to dose it that high. Like I have no issue sleeping, but I still take 3 milligrams a night. Like I think 3 milligrams like is a good. Yeah, they can. They can.
they're
They don't
producing a lot.
necessarily need it, but if they do need it, it's okay for them to take some, yeah. Because maybe there's something there could be some dysregulation in that pathway, but your pineal gland like literally calcifies. It starts to calcify.
And there's no
And-
harm in it.
I mean, people will say there is,
Yeah,
but
I've
like
heard it.
the studies and I mean, I can give you thousands and thousands of studies, like from our arsenal of 34,000 papers from my global research group that I work with, that shows you everything that melatonin does. So for
My
me,
daughter takes it. I just have heard that there's other,
I think it's one of the best,
I mean, she's
especially for
better than
fighting
anything else.
infection and for your immune system. I think it's amazing. Yep.
more important to sleep, right?
Yeah.
Exactly.
Right.
Extended release.
This-
There
this-
is such a thing.
Yeah. Some of them are, I don't know if that,
It's not.
yeah, this one's not,
But it's only
but
3
if you,
milligrams.
yeah.
So we have a question about a supplement that you spoke about earlier.
Yeah.
What is black cumin and is it different than flaxseed?
Yes, totally different.
Okay.
Black, here, why don't you answer that
Yeah,
question? And
so-
it's a hero food, right?
It's, we
Mhm.
call it
It's
now
a
here,
hero
it's
food.
Nigella sativa.
Mhm.
And it does a lot of things, and why
You can
she's
cook with it.
posting it. Right, well, I actually
Tell us.
have a recipe that I gave you guys with powder, because you can use it in a powder form
He wants
also.
to get the recipes out.
Yep.
Yes,
Yeah.
you'll get everything.
So
Mhm.
it actually does so much. It helps with respiratory, it helps with immune function, but it's really good around cold times.
Mhm.
And that's why she's putting it in there, because of all, it's actually just a very potent herb. It's really good. And you can do it, you could buy it powder, seeds, or oil. So the recipe that I gave you was for powder, and it gives you the amount of how much to put in.
Okay, I'm gonna just quickly talk about a few other things that aren't in the packs necessarily. Well, this is in the acute pack, but this Cofix RX, so everyone asks like, what can I do? Like, to prevent stuff like especially with COVID and flying or the flu and whatever, or being in a big room with like hundreds of people. So I love this Cofix RX. It's all it is povidone iodine. Okay. Povidone iodine, 8 doctors got together. They patented this. There's 2 major studies out of 2 universities, like one in Utah, another one on the West Coast. In vitro studies show that it has 99% activity, like it basically kills SARS-CoV-2 in vitro, 99% efficacious. Also influenza B, common colds, a few common cold strains they tested, so on and so forth. So what povidone iodine does is, again, what's your first entry? Your portal is here. So when you do the nasal spray, so my daughter, for example, she's blind. So I told her, you're going to do it. She did it yesterday. She's doing it today before she gets on the plane. So, she's not masking. She's going to use this. Okay. The problem is that you can't use too much of this because it's iodine, and what iodine affects your thyroid gland. So 2 contraindications. One major contraindication, if you have a history of thyroid cancer, you really need to definitely talk to your doctor. I mean, you need to talk to your doctor about any of this stuff. Let me just clarify, I'm not your doctor. So everybody should talk to their physician about any of this stuff. None of this is a cure. None of it, it's not really quote unquote a treatment. These are just like interventions and solutions that we're coming up with for people. Okay. But this is fantastic. There are studies behind this. Okay. And you can use it like pulse it, so if you're traveling, if you have an event, you use it for those few days at a time. When you're acutely ill with a virus, flu, any of those things, you can use it for the 2 weeks, or if you're sick for that long, or just use it until you feel better. But you shouldn't use it for more than 2 weeks, because that's when they found it could really start to affect your thyroid gland. So you just want to be careful. And people that have thyroid issues, they can take it, it's fine. But again, you don't want to take it for extended periods of time. So this is a thing, everyone in the house should have that. Before you travel, before you go somewhere, it's amazing. My whole family uses it. It's great. So I love this.
Do you prefer that over for tablets?
Tablets for what?
Iodine tablets.
Yeah, because you can spray your nose and you can spray the back of your throat with it. They have a spray too. And so your coat, yeah, they're fantastic because you have to get up here. this is your main portal of entry, especially with the newer variants, the Omicron, they get right here and they get right into your brain, like straight, like very well studied at this point. So you want to protect this. It's very like, yeah, like it's not lethal or, no one's worried about like any like horrible like anything with mortality, but like you still want to protect yourself from these things. Yeah.
I bought that last year and I tried it.
Yeah.
And I immediately started like sneezing.
Yeah, I do too.
And-
I'm sensitive to it. It can, some people are sensitive to
Are you
it.
still absorbing it?
Yeah,
or
yeah,
sneezing
it's still
them?
getting, it's
So
still
getting in there.
sticking. It's sort of like, when your kids used to go for like, I don't know, at least my kids, there was a time when they weren't doing the shot and they were doing the flu
Yeah.
thing. And my kid would like right away, like, I'm like, they didn't get it. And, but they do, it gets up there and it does its thing, even though you might sneeze and so on and so forth. Then these are this is homeopathy. So homeopathy is like a little difficult to explain. We have it will take me too long, but on our website, I have a whole explanation of what homeopathy is, why it's a true science, why it can work and be effective. And we have an influenza one and we have a COVID one. So these are fantastic. And then the last two things that I didn't really, let me talk about this. I didn't get into everything on the acute COVID protocol or acute viral protocol or the preventative protocols that, you can use, but this is the backbone. This medicinals is the backbone to those protocols. Okay. And I'll explain why. This has numerous studies behind it, both in vitro, in vivo, and even some clinical trials. Okay. This has 9 very bioavailable, potent polyphenolic compounds in it. Okay. These compounds that are in here, everything from rutin, quercetin, hesperidin, what am I missing? EGCG, wait, it's right here. Hold on, where?
I don't know if you're reading.
Oh,
And this is what I.
glycerin, quercetin, citrus bioflavonoids, anyway, whatever. It has 9 and all of these compounds, the thing about when you use natural compounds too, your body knows what to do with it. Like from an evolution, this is what heals us. So your body, these compounds like know where to go and they act on like hundreds of pathways simultaneously. So that's what's so great about this. And the problem is many of the bioflavonoids that we take in pill form, we're not really absorbing it and we're not getting it. This was designed specifically to have a very, very potent bioavailability through the gut, like 10, I don't know, 70%. I got to look back at the trial, is very impressive. Okay. And they have studies around showing how fast it lowers the viral load.
Different than the packs.
This is different. This is different. Those are maintenance. This is more like if you get sick, you can also.
Lindsay was talking about.
Yeah.
So when
She was
when I-
taking with the rhizo.
it's a liquid.
It's a
You
liquid.
mix it together.
It's a liquid.
Mhm.
And so, if you get sick, it's like a great thing to get on board like right away. Because of what it's going to do for you. And then you mix it, vitamin E potentiates. We have the emulsion from Biotics Research that we use in
Oh, that's what I also.
coordination with this because it helps push it across the gut barrier. So it gets absorbed beautifully. And then it also, when you mix it with the rhizo, it just does really fantastic things. Like all together, they work in concert. So we mix some of this with the rhizo in water and then take the vitamin E and then all of those other beautiful supplements you can take along with it. So this is what we do, but this is a really amazing product.
We get a
and one of
positive
them-
COVID result where we get the flu.
You
we
should
start
take,
that.
you should.
Yeah, that's the bottom.
With the
Everything
rhizo.
else, the other part, we're doing.
You could do some
we're
maintenance,
just doing
right,
maintenance, But
right.
we just like need it home for what.
Yeah, like a pat, like a
Right,
pat,
yeah,
like a
let's do
pat.
it.
Like my daughter has it at school and she started it when she got sick, like, how I told her
Yeah.
based on, the instructions, but this is it's really great. And like I said, has tons of studies. We're going to be doing webinars around this because we do a lot around long COVID. So this is a
Well, that's
backbone.
what I was
This is
wondering, like, would George do that?
yes.
Like just live like that, right?
Well, with the other things, yeah,
Right.
with the, yeah. Her husband is he has long COVID. So, and that's becoming more and more problematic, as each day goes by. So anyway, so this was, developed in response to COVID in January of 2020. The inventors dropped everything that they had. They figured out what we needed and what pathways needed to be addressed, by the virus and the S1 spike protein. And this is, and now so a new enhanced formulation will come out in the next few weeks, but it's the same. It just has different, some different excipients, which are a little even better, but it's better to have this than nothing. And I don't know, with regulatory. Yeah. So anyway, I'll switch you guys over when the newer one comes out too. But yeah, this is. Awesome.
So this has been a lot of information.
Yeah, sorry.
And
sorry.
the purpose of having these bundles on the shop page. So if you go to trainhealth.org and you go click shop and you go to buy supplements, we've created these bundles so that it's kind of like that easy button. Remember Staples had that ad, like you press the easy button. It's kind of like the easy button. You can buy any one of the bundles for preventative measures, for immune boosting that include a lot of the Biotics Research, supplementation in there. There's going to be the acute viral protocol on there as well. So if you do get sick, you can
It's like
purchase
ready to
that.
go. No, I mean, most of my patients just have it in their house, like
Have it in
ready
your
to go,
house. Exactly.
like ready to go.
I mean, it's
Um,
definitely in response to the questions. We get lots of phone calls or
Mhm.
appointments that we do.
That's why
It's
we
like,
develop these.
what do we do to prevent it? What do we do when I get sick? What do I, what do I do?
And you'll
So-
see like silly things on there that you probably already have in your house. Like there's regular saline spray, there's the Xlear, which you can get on Amazon or
Oh,
any.
The Xlear, right, the Xlear is part of the, that's also a good preventative measure, like how Lorraine said, the xylitol. Xylitol is very effective in killing viruses, like right away. So, it's a great like I do 2 sprays in each nostril twice a day. Like I take it, I've been taking it all through the pandemic, actually, so.
But I also wanted to give you the phone number to call here in case you do have any questions. You can talk to one of the people on staff. So that's 203-900-4416. So 203-900-4416. If you have any questions around the protocols or the packages, but you do get 20% off using Immune 20 on the shopping page for any of those 3 immune.
No, and the acute.
And the acute and the,
Yeah.
yeah,
So the 5.
there's 5 different bundles. You get 20% off for all of them until October 15th. So hopefully you can stock up on them now. And then in the case that you need the acute, you can always call and talk to one of us about, the dosing up.
What were you gonna say? Yeah.
There's a question on Zoom for Tracy. I know this is it's about something you talked about earlier, but she wanted you to just talk about how IV therapy can impact the body's natural immune system. Like, can IV therapy override the natural
No,
immune system, or does it support?
it's
to function
supporting it.
better?
It's supporting and enhancing it. Yeah.
And then the follow-up question was, do you ever get to the point of getting off supplements or IV therapy? So maybe that's a question for everybody.
Oh, I mean, here's the thing. I use supplements to bridge the gap when we're trying to heal patients, right? Because like I say, unless you're a cow and you eat grass all day and live in a bubble, you're always going to have some sort of dysbiosis, some sort of issues with leaky gut and so on and so forth. So, while we're working with the patients like Mary to address those 4 pillars of health, I'm bridging the gap with a bunch of these supplements so that you get to the finish line faster, because especially in America, we're very impatient. Everyone wants to be healed right away and so on and so forth. But also the idea is you want people to feel better so they can get better, right? And so by giving the supplements, it helps people feel better faster also, so that then they're more motivated to, get to that finish line. So we do that a lot on purpose. And then no, I don't want to keep, it depends also what your medical issue is, what your problem is, what's going on with you, on how much you stay on in the end, or how much you need or don't need too. Like everything's individualized. That's what we do here. We practice like personalized, individualized medicine, like proactive care. That's what Train Health was built on. That's our mission, part of our mission. So it's every person's different. But like I said, there's always going to be those handful of, nutrients, vitamins, or compounds that you need to stay on because we're just not getting enough. And most of us are depleted. We're just depleted of it. We don't have enough,
And-
in
and
our system.
Yeah, when Dr. Rose and I make a suggestion based upon supplementation, it really is after extensive histories, physicals, and biomarkers and lab work, right? So we're not just saying, oh, take this before this. This talk was about how to stay healthy, prevent illness, and if you do get sick, what do we do to kind of heal and get better quicker? But for supplements, is exactly what Dr. Rose said. It's to bridge that gap, and it's based upon extensive biomarkers and labs, right? So if people are B deficient or they're G deficient or cardiovascular or disease wise, I mean, you're doing that based upon that plan of lab work. So that the goal is never to have people on this forever, but it's to just kind of fix the issues and then maintain.
And we're living in a different day and age now.
Yeah.
This is a brand new world with a lot of new toxins and viruses that are attacking our bodies. You all know this, right? This is why you're here today or listening online or watching this recorded, because this is not 20 years ago. This is not 50 years ago. This is,
I call it
20.
the post-viral or post-COVID world that we're living in.
Yeah,
It's very
it's like
different.
a
It's
viral
very different.
apocalyptic age.
And the inflammation that we deal with patients that don't even know, like inflammation leads to chronic disease. So like we're looking at markers to see that affect cortisol levels, affecting their sleep, affecting their gut health. So it all is a big picture, right?
So we're doing the work of the day. We're trying not to borrow problems from tomorrow. And we're setting a strong foundation for our immune system so that if we do get sick, maybe it won't be as bad for us. That's the hope. That's the goal. And then if we do get sick, we can get over it faster without all of the lingering
Exactly.
issues that can come with it.
Mhm.
So thank you all
Thank you.
so,
Thank you.
so much for your
Thank
time today. And again, all of this will be on terrainhealth.org. You can check out the website. We will have more of these if you can come visit us. We have lunch back here. We have some great samples to give out to the people who came here in real life. And anyone who is joining us remote can also take advantage of the special offer until October 15th to get that extra IV therapy for free. When you buy a package of 4, you get the 5th for free. And then you also get 20% off all of the 5 bundles that are on the shop on terrainhealth.org using the code immune20.
Yay.
That's it.
Thank
Thank
you.
you all.
Thanks, everyone.
Stay healthy.
We have bundles here. If anybody's interested in just grab and go, like, just let me know. I can take your order and please help yourself.